There we go.
We are starting to record now.
Thanks, Chad.
I think we're probably good to get started, First Lady, and a couple of folks will likely join soon.
Okay. Well, hello and welcome back. Excited to see you. We are being recorded and live streamed. Before I get into the agenda, I'll do a little update about some stuff I've been doing. Was able to visit with the governor to the Clackamas County Stabilization Center for the grand opening. It's a stabilization center that provides a safe place for individuals in crisis to receive support. I believe they're 24 hours. It's another example of people working together. There will be a transitional housing program on site, and it's just a way that people are meeting the current moment. It was a really exciting thing to do. There were lots of great partners there, and it's just exciting to see people being able to access treatment kind of one place at a time. And then the other thing I don't think I mentioned the last time is I missed a meeting because I was doing a trade mission, and part of that was while in Japan, I got to spend some time to do a roundtable discussion, and it included behavioral health organizations that were working on social support, social isolation, services for vulnerable populations, and specifically around reducing suicide. Similarly, I got to meet with another group of people around the National Center of Comprehensive Support for Bereaved Families of Suicide Victims, who has a relationship, their leader has a relationship with the Oregon Dougie Center. And it was a really incredible opportunity. There's some things that I've learned that I've been able to share, and it's opening a dialogue between our countries and our organizations, and look forward to doing some further connections. So that's kind of an update. Today's an exciting meeting. It's action plan time. So we're going to have our first presentations and for action plans that have been advanced from the Education and Training Committee and then the Licensing and Credentialing subcommittees. We're also going to hear from two culturally specific organizations serving the Latinx communities. So to accommodate the guest speakers, we're going to start with a couple of action plans, and then we're going to hear from the organizations. We'll take a break, and then we'll review 3 additional action plans. You've gotten copies of the action plans prior to the meeting. There'll be opportunities to create feedback. I appreciate people as we figure out this process. We're doing this for the first time, and so we're going to learn, and then we'll see how it works for the next meeting. I'm going to turn it over to the one and only Taylor Smiley Wolf, our fearless leader, who has shepherded us through this process, and she's going to walk through what we're going to do to bring these plans to completion.
Thank you so much, First Lady. Can folks hear me okay? Great. And are you able to see my screen? Wonderful. So I'm just going to talk a bit about the process for advancing action plans for the purpose of finalizing the report that's due to the governor on January 31st of 2026. So just to ground us in the council goals are to address the worker shortage that was identified in the talent assessment report, preventing the loss of workers at high risk of turnover, also as identified in the talent assessment report, increasing the cultural competency and diversity of the workforce, and finally, improving recruitment and retention for providers that are serving the Oregon Health Plan members. So in terms of process, subcommittees have been hard at work developing action plans that include strategies, clear leads, as well as preliminary timelines for implementation to advance the specific HEC recommendations that action plan addresses that will all aggregate up to the final report. So once a subcommittee elevates the plan for the full council to review, a lead member from the subcommittee will present on the draft action plan. And this is an opportunity to really get the feedback and expertise from Behavioral Health Talent Council members who maybe weren't members of this particular subcommittee, but certainly have valuable expertise to share related to all the action plans that are going to be coming forward for consideration. So there will be opportunity for folks to provide feedback, and we recommend that feedback be focused as much as possible on the changes that might be needed to more effectively meet the council's goals. And then finally, the chair and vice chairs will review all the feedback that was received on each action plan during the council meeting and consult with subcommittee members if there's anything substantive that came up before determining how to incorporate that as the plans move into the final report. So it's more of a continuous improvement process than it is a formal raise your hand and vote process. So really feedback, opportunity to incorporate before the plan is finalized. And then of course the council towards the end will be invaluable in crafting and finalizing the entire plan itself. So with that, as folks are presenting on action plans, we just recommend that you hold a couple of questions to think about to inform the feedback that you provide. The first being, does this action plan hit the mark by achieving the council's goals that we just reviewed? And then what impact could you see that each of the strategies in a particular plan could have in your practice setting? So what are those impacts and how might that inform your feedback? So that was it, short and sweet. First Lady, I'll turn it back over to you.
Always with the muted. Okay, that's kind of it. Does anybody have any burning questions? Okay. Action plan 1 from the Licensing and Credentialing Committee on Communications. This communication plans from this committee, and I'm going to pass the floor over to Casey Liddell.
Hello, everybody. Casey Liddell, Policy Advisor on Behavioral Health for the Governor. I have also been the staff person for the Licensing and Credentialing Subcommittee. I'll be presenting on these action plans today. I was just speaking with our committee chair, Eli, at the planning meeting we had for our next meeting about how excited we are to get the opportunity to pass these on to the full council and really start getting feedback from everybody in all the different great areas of expertise that people have. And so, yeah, thank you very much. Next slide, please, Chad. Oh, so these are in the opposite order that I thought they were going to be. So I will just go ahead and jump in on the entry-level positions, and then we will move on to the communications in the next action plan. So for some context for this action plan, one of the HEC talent assessment recommendations that was assigned to our subcommittee and that we were looking at was a recommendation about supporting behavioral health technician positions as sort of an entryway to the profession. These are positions that generally are well paid, are a good sort of starting point for people, and do not require licensure. What we found when we looked into this is that there are a lot of different positions that sort of fall under that umbrella, and kind of everyone calls them different things. So they are sometimes called behavioral health technicians. They're sometimes called behavioral health therapists, mental health technicians, mental health therapists, residential counselors. There's sort of all of these positions that ultimately encompass sort of the body of work that is done by people who have not been formally licensed, but who are doing a lot of sort of the frontline client-facing work in a lot of these settings, including residential settings and hospitals, and are really key members of the treatment teams in those settings. And so what we wanted to look at in this set of recommendations is, how do we support those positions? How do we make them a more sort of attractive entry into the field? And then sort of for the second recommendation that we're making, how do we make it easier for providers to actually have those positions be a part of their team? Because as unlicensed positions, those positions are not generally able to bill. And so for a lot of providers who who are in a fee-for-service model, it's very difficult to incorporate these positions into their treatment teams. So we were focused on the tiered pathways into the field, on making these careers sort of more mobile for people, on incorporating them into those team-based treatment models, and eliminating administrative burdens rather than imposing new ones. And next slide, please, Chad. So here are the two recommendations that came out of that discussion. The first one, I think sort of the biggest one, is creating a non-licensed entry-level behavioral health credential that gives a pathway into the field that bolsters mobility and encourages professional identity. So this is going to be for people who are doing those entry-level positions. One of the things that was sort of flagged in our discussion is that we have these career and technical education programs that are seeing a lot of success, particularly in high school settings. I think there's going to be recommendations discussed about those coming out of the Education and Training Subcommittee, but often it's very difficult for those people sort of coming out of those programs, having not actually had sort of the professional background yet, to go into those entry-level jobs because of kind of the lack of a credential to show the experience that they have through those programs. And then similarly, one of the problems that we identified was entry-level people are required to do a number of trainings by the health authority in order to be able to do those jobs. But then if they decide that they want to go work at another provider, or if they move and switch to another job, they have to do all of those trainings over again, which is a burden on them. It's a burden on the provider who generally has to provide the training. And it means that they can't jump immediately into sort of working with clients, which takes time away from everyone. So what we wanted to do and what we've discussed doing is having MACBO create an entry-level credential that can follow people who are doing this work. What it's referred to generally as direct service workers, and that is actually something, a set of skills that MACBO is already sort of certifying as part of some of their other programs that can be the basis for this, but would basically allow these people to achieve a credential that sort of gives them some buy into the system early in their career, gives them that sense of professional identity, and also means that if they have to move between employers, they don't have to redo all of that training, but they can sort of continue to do the work. This is something we really had a lot of discussion around, making sure that this is going to be a complete sort of positive to everyone, rather than creating additional levels of administrative burden, additional hoops for the workers to jump through. And so we really want this to be a optional credential, and something that is not something that is making it so that they have to do less work, not more work. So we are asking that MACBO work with sort of providers to create this credential and make sure that it is actually sort of fitting the need that exists right now in supporting these entry-level workers, and making it so that they sort of can feel like they are building towards something as they enter into this profession. The other recommendation that came out of this discussion, we have had a lot of discussion in this Full Talent Council about the importance of team-based treatment models. And this is a place where not only do those models support the entry-level people, because it gives them sort of the role that they need to be able to do the work that they're doing, gives them a way to sort of enter into the field. It's also a place where the work they do are very important to everyone else working in the field, because something that we've heard in a lot of these discussions is that without the proper support, it's really difficult for the licensed personnel to be able to operate at the top of their license, because they have to do a lot of work that is not necessarily what they have been licensed for, what they're being trained for. And if they do have like a full and robust team where those roles can be assigned to the people who are sort of best suited for them, that makes everybody's jobs better. It makes everybody's lives easier. So I think there's going to be a few recommendations coming out of different subcommittees that are asking us to take a look at some of our billing structures to find ways that we can potentially improve them to support these treatment models that are evidence-based, that we know work and we know serve people better. And this, I think we want this to be a part of the conversation, is how do we create models of funding that can incentivize team-based treatment, incentivize bringing in these non-licensed people who are coming into the profession, who are potentially going to be getting licensed at some point, or who are just wanting to work with these clients. How can we create a system that sort of incentivizes providers to be able to follow those models? models. And as I mentioned before, the fee-for-service model is a really difficult one for that because they can't bill. And we heard that there's a real divide between, for instance, residential settings that are not billing based on fee-for-service and can therefore sort of figure out how to make their budgets work with bringing in sort of a treatment team versus outpatient settings where we heard from people saying, we would love to have more entry-level people. We would love to have sort of more support staff for our licensed people, but the billing models just don't allow us to, they don't make it possible for us. Next slide, Chad. So as I mentioned, some of the outcomes that we would really be looking to support here is improving accessibility to the field for young and new workers. So we could be looking at increasing the number of people coming out of those CTE programs or otherwise coming from a sort of non-licensed background who have not gotten to graduate degree who can go into this field. Increasing that sense of professional identity and investment in the behavioral health field for non-licensed workers. So making people feel like they're not sort of just being brought on as, you know, another hired set of hands, but that they are really a part of something and that they are entering into a field that can be their future. And by doing that, we're hoping to increase the number of entry-level workers who remain in the field or seek additional education and licensing to continue to sort of move through the field. And then support the team-based treatment models through flexible billing structures and hopefully see more providers able to implement those team-based models if that's what they decide is more appropriate for them. Next slide, Chad. So as far as barriers to implementation go, we really want to avoid adding any additional unnecessary complexity to the system. This is something that we've heard in the main talent council and all of the subcommittees is the last thing we want to do is create more administrative burden, create more hoops to jump through, make the system more confusing for people who are wanting to create careers in behavioral health. So I think it's really been emphasized at a number of points in our proposed action plan and throughout the conversations we have had that this is something that we should only be moving forward with if we think that it is going to reduce the challenge for people. We don't want to create another credential for the sake of creating another credential. We want to create a credential that's going to help both employers and workers. And then as far as looking at the other funding models, we're going to have to sort of review with our Medicaid experts, figuring out what is and isn't possible within the realm of those rules and laws that exist outside of our control. But we are hoping to be able to sort of move forward with these ideas within the next 6 to 12 months, at least in sort of being able to put together a plan to implement the new credential and begin discussing the funding models and then continue to monitor and make sure that we are getting lots of feedback from our providers to make sure that these are continuing to be things that will be helpful for them. Next slide, Chad. All right, so this is the next one. Taylor, were you wanting to stop between action plans for potential discussion or discuss at the end of both of these action plans?
First, I defer to you.
I know we're running tight on time. However, I think it probably makes sense to open it up for because they're different. And so mostly first and foremost, does anybody have any questions? Okay, perfect. Is there anything anybody wants to say at this time regarding this plan? Okay. Do you want to keep moving?
Absolutely. And before I start on the next plan, can I get a quick time check, Taylor? I feel like I'm talking too fast. And I want
About
to if I can slow down.
9 minutes.
9 minutes. Okay, I can do that. All right, so the next thing that we discussed, we wanted to look at how we are sort of communicating opportunities within this field to people and also communicating sort of the way that you navigate the field, the way that you enter into certain positions and everything like that. Because I think a lot of that happens right now through sort of word of mouth, talking to your coworkers, talking to your employers and everything, which is fantastic. But for people who haven't yet entered the field, for people who are considering sort of moving from one position to another, it would be good to have a centralized resource for them to really understand sort of the options that are available to them. And this is something that came directly out of the talent assessment, specifically looking at something that Massachusetts has implemented called the Careers of Substance, which is a website that Massachusetts put together that lists out all of the different careers in the treatment of substance use disorder that you can pursue, and just has a ton of resources for each of those careers, not just for people who are in them, but for people who are potentially considering them. So what we want to do is increase access to the information regarding these careers in a similar way, including creating a central hub for all of this information. And I will say you will hear from this from the Education and Training Committee about this idea as well. I think that we were very much on the same page in terms of some of the suggestions that we had in each committee and wanting to sort of combine them into a central resource that people can use. So first of all, we want to create an accessible, understandable behavioral health career crosswalk. That is, again, something that came directly out of the talent assessment. And I think given sort of like the number of credentials, the number of positions, the different ways that some of those positions are defined in different settings, I think it would be helpful to really have that laid out for people of like, if you have this credential, here are the different things that you can do, and here are the ways that you can move to another credential or the next level of what you're doing or everything. We also want to launch that centralized behavioral health resource hub. We'll give the Education and Training Committee the credit for actually coming up for that name. I think it was coincidence that I got to go first and actually say it first, but they're the ones who came up with it. But want to have a place where people can go to get all of the information they need about the career that they're pursuing. That includes scope of practice, that includes educational requirements and where you can meet those requirements, licensing requirements, resources, professional development resources. And then in the Massachusetts one, they actually even have a like job posting linked to all of these. So you can read all about a specific position, and then you can say, okay, who's hiring for that position? And with one quick click, you can go through to that. And then the final thing that we incorporated into that is real-time chat-based customer support in the licensing agencies that don't already have that as a resource. MACBO has already implemented that. I believe that the nursing board has either implemented it or is working on implementing it, but we want to try to have the resources for everyone to do it because they have expressed that that is something that is really helpful for people who are trying to navigate the sometimes complicated requirements for licensing and getting into a profession. If you have a problem with your application, if you have a question about one of the requirements, just being able to immediately chat with somebody who knows the answers to those questions, I think can really be the difference between sort of feeling discouraged and feeling like, hey, this is like a welcoming profession. Next slide, chat. So as I mentioned, we do want that crosswalk so that we have a really easily understandable grid of all of the positions that exist and the pathways that exist through those positions. I think that sort of goes hand in hand with the resource hub, because the resource hub will then give you the opportunity to say, you know, okay, I understand that one starts out as a direct service worker and then becomes, you know, gets their QMHA and then gets their QMHP or any of the other sort of ladders that one can advance along. But then with the resource hub, you can say, okay, if I'm a QMHA, how does that mean I'm spending my days? Like that's one of the things I actually love the most about the Massachusetts website is it wasn't just saying in a very abstract way, what's your scope of practice? It's what are you going to be doing day to day of this? Like, what are you going to be doing with your clients? How are you going to be interacting with them? Which I think is really a lot more helpful with people who are trying to imagine what kind of career they're going to have. So we want to establish that resource hub based off of that career crosswalk with all of those resources to help people understand what options are available for them to work in the behavioral health field and which of those positions might fit sort of what they want to do, what their talents are, what they're interested in, everything like that. And then providing the real-time assistance to people so that as they're doing all of that, if they have any questions that come up around any of those complexities, they have somebody whose knowledge and experience they can draw upon to answer those questions. Next slide, Chad. And then our key outcomes and goals, common understanding of what the positions and what the system is, transparency around all of those requirements, and clarity and efficiency for people who are trying to get into the system or trying to work their way through sort of into a different position, things like that. And I will go ahead and I think is there one more slide, Chad, or is that the end? All right, yes, and the equity opportunities. So we can, I think it's important to prioritize inclusive design for this, including culturally specific organizations and community voices in the design, and making sure the materials are translated into non-English so that people who are not English as first language can potentially be able to access these resources. I think it's important that we collaborate. There are already a number of culturally specific organizations who are doing sort of some version of this for sort of their own communities. And I think it's important to make sure that we are linking people with those organizations and trying to sort of support their work rather than trying to reinvent or supplant it. And then providing a level of accessibility to the workforce for people who are coming in along different paths or from different cultures and might be able to sort of use this to help navigate into this system. And I believe that's everything. I will leave a little time here at the end for discussion.
Hey, I like the work of the subcommittee and good recommendations, both. So excellent work.
I'll just say it's been a fantastic group of people to work with, and it has been really amazing how thoughtful everybody has been about everything we've talked about.
And then Casey, this is Ebony. I'm driving. I just want to say too that I know in one of our committee meetings, we, thinking about the federal implications and potential impact on, billable services and a reduced workforce. He, talks about that, losing the North Star of staying focused around what our goal, what our aim is to build out kind of a workforce that, that meets the needs of all Oregonians. And so just appreciated being able to have that hope and focus to not lose sight of, what our focus is. So just want to appreciate your leadership on that.
And I appreciate yours. I think that's right on the money for the time too.
All right. Great job. Again, there'll be more opportunities to collect feedback. Packed agenda. It's really exciting. Thank you so much, Casey. Thank you to the committees. This is really great work. You'll see the same themes throughout, and that means that we are on the right track. Having different collections of people on different subcommittees was intentional. And so when we are coming up with similar answers, that means that those are the right answers. So the duplication in this case is a good thing. And they'll be similar and have some slight differences, and that's exactly the hope. Okay, so we're gonna switch gears a little bit. And we're gonna go into successful strategies. And I just want to say, given the national threats and the broader political context that we're in, the Latinx community faces particular difficulties and vulnerabilities. And as this group knows, our behavioral health systems must provide culturally specific and appropriate care that caters to the unique needs of these communities. When we look at the Talent Council, this is where some of our most underrepresented workforce is. And so we're really excited to have presentations on best practices. Is Ingrid Solares, am I saying that right? I'll make sure, okay. Is the Director of Equity at Alante Mujeres, where she leads culturally responsive, trauma-informed mental health wellness programs for Latinx women and families. She's a licensed social worker with a bachelor's and a master's from Portland State. and has over a decade of experience serving the Latino Latina immigrant community in Washington County. Ingrid, let's see. Oh, I lost my place. I don't have this all memorized. Ingrid joined Alente as a board member in 2014 and later served as the board president before stepping into her current leadership role in 2023. Her work centers equity, cultural identity, community empowerment, and uplifting the resilience of the communities she serves. We are so fortunate to have your wealth of experience with us here today. And I just want to open the floor to you.
Thank you very much. I really appreciate you thinking of Adelante Mujeres and for having me here. I did provide some slides. I don't know if they're ready to go or not. Yeah, so again, thank you for the opportunity. I am here on behalf of Clínica Esperanza, which is a culturally specific behavioral health clinic located in Hillsborough over in Western Washington County. Our clinic is currently staffed by clinical social work associates and one occupational therapist who's registered as a QMHPR. We have community health workers, two of which we helped to become qualified mental health associates who work hand in hand with our therapists. So just a little bit about our clinic. I also just want to highlight that we are not the only culturally specific clinic. I want to give a shout out to our community partner, Latino Network, La Zenith Clinic, and also Raíces de Bienestar, Puentes, Asian Health Services. So there are a handful of culturally specific mental health clinics. You can go ahead and go to the next slide. So yeah, I also want to just acknowledge that Oregon has made major important investments in the behavioral health system, and we are very grateful. But you know, we're still the workforce still needs to be stabilized because it's very, very difficult to run a mental health clinic. We're trying to come in from a cultural perspective, and we're meeting up against a system that was the broader dominant mental health system. It's really difficult to navigate. We all know this, and it is really difficult trying to create a culturally specific mental health clinic when we're trying to interface with the dominant culture. We're very grateful for the funding that we currently have. And also I will highlight, the amazing support that we have already received from Oregon, such as the CLSS, higher fees, and culturally specific funding. However, as you all know, in the current state that we're in, this is all under threat. But yeah, just want to highlight, that the culturally specific workforce is essential to Oregon's behavioral health goals. Clinicians serve communities that are mostly impacted. The cases are very complex, high needs, especially during this time. And therapists, Spanish-speaking therapists, they usually take on multiple roles beyond traditional care, such as translators, culture brokers, navigators, and that's why we so much appreciate being able to count on also community health workers and QMHAs to help the therapists do this work. So we've made great strides, but my fear now is that it's all going to roll back and disappear. You can go to the next slide. And so there's also systemic realities here, like I mentioned, there are unconscious biases that affect policies and norms and expectations. Just to name one, when I was in the trenches, I was often passed up for any leadership role because I speak Spanish. I was one of the only Spanish-speaking therapists. They needed me on the ground doing the work. I don't mean on the ground, but on the front lines doing the work. And so I was just passed up. But and maybe there were some ideas that maybe because of unconscious bias that I wasn't smart enough because I'm a person of color, or that I wouldn't be able to do such a big thing. So that is a real thing, Also, there's cultural healing practices that are often omitted from or acknowledged in models. And there are barriers in the traditional healthcare system that also hinder people from accessing needed sources. There is a solution for that, because there's this integrated behavioral health model, which is great, but you can't just have one in a whole clinic of thousands and thousands of people and say that, that's just like checking off a box, that person will burn out for sure. I was in that role for 7 years, and it just feels really like you're drowning all the time. Cultural healing practices such as, well, you can go to the next slide. So communities, and from the Latinx community, indigenous communities, we do rely on practices like barridas and limpias. A barrida, I have a little bit of rosemary here. A barrida is basically, sweeping the negative energy, being able to go from therapy session to the next therapy session, and being able to bring in these modalities are so important, because this is the kind of interventions that our community believes in. I also have a lemon here. You could do a limpia with a lemon, but these are not recognized in the dominant model. These kinds of interventions, they support emotional release, balance, and somatic regulation, but the system doesn't recognize or reimburse these modalities. You can go to the next slide. There is a big, the retention crisis is real. The administrative burden of documentation, having to translate like what you just did in the therapy session, translating it in Spanish, putting in their quotes in Spanish, and then following all the OARs. It's a lot, most of the time, Spanish-speaking therapists have the heaviest caseloads with the most complex cases, and it's the least structural support with the lowest compensation. But again, highlighting the CLSS that we have increased the fees. I think it's about $225 per 60-minute, the 90837. But it's again, the fear that this will all go away, and we would have to rely on fee for service, which it would be very, very, very difficult to do so. Next slide, please. So when therapists burn out and they move on, the impact to the community is the loss of trusted providers, which reduces engagement. People then don't trust the system, and they're like, why am I going to start over with a new therapist? And this happens a lot, all over in all of the community mental health clinics. This happens, that there's turnover, and it becomes hard. So then, there's increase in crisis, and then a lot of unmet needs. People who don't normally trust big systems are at risk for greater disparities, and being able to obtain services. So next slide. So what can we do? What can Oregon do? Find a way to recognize culturally rooted interventions, or some people in the state can maybe help support translating these culturally rooted interventions into how do you document it per the OARs. Address structural barriers shaped by biases, the importance of recognizing, Spanish-speaking therapists or just therapists of color, and trying to move them up along into supervision roles, because you have to have also a culturally competent, or at least cultural humility, to be an effective clinical supervisor when you're working with clinicians of color. and yeah, streamline pathways for licensing and supervision, which I hear that that's something that y'all are already working on. And then also amplifying occupational therapists as mental health providers. From our experience, occupational therapists really provide the functional impairment, helping people to get unstuck with behavioral interventions. We have one OT who was a student, and we were able to hire, and they do amazing work. Next slide. Yeah, so I know you have here Veronica from Latino Network, and there are other amazing leaders doing this work, and I believe we want to collaborate, and we are ready to partner to help improve the make systemic improvements. We do bring the community trust and the cultural expertise, and I do think together we can build a system where the workforce thrives. The next slide, please. Just a little bit more about our clinic and what we offer. The next slide. We have a combination of culturally specific mental health services, so like the individual therapy, and then we also have a lot of groups and workshops to help people come together, whether maybe they're not ready to engage in therapy, but they want tools and they want to heal in community. And so this is what these groups are about. It's helping people understand like the basics of what is mental health, bringing awareness to the symptoms. And then there's also, Parent Cafe, Circle of Security, which we partnered with Washington County to get the training for that. And we have seen, very successful stories about people, like one mother who attended Circle of Security, Parent Cafes. Well, I think she attended both, but Washington County had another set of funding, and they were like, okay, can you bring in a parent so then we can train the QMHA, who's the facilitator, bring in the parents so we can train them as well. And then that was pretty amazing. After that, this parent went on to get another job somewhere else as a community health worker. So that is really amazing. Taylor?
Just a friendly time check.
Oh, okay. Am I done with my
No, you have about a minute left. Just wanted to make
Oh.
sure there's also some time for questions.
Okay. I also want to just say right now during this time how incredibly difficult it is for our staff to come to work, but we are coming to work because at the same time that our participants are facing extremely they're being terrorized, so is our therapists are also part of mixed status families, and also there's a lot of fear in the community. And so just big shout out to all the therapists that have a mixed status family, how difficult it is right now. Like just yesterday, I had a therapist that came into my office, and she's like, they're at my uncle's house waiting. They're looking for him. ICE is at my uncle's house. I can't get a hold of my parents. And then I was like, what do you need right now? And then she was like, I think I'm okay right now. I'm going to go into my session. I was like, do you need to cancel? And do you need to go home? She was like, no, I'm going to stay here. Luckily she was able to get a hold of her parents, but yeah, we are in a crisis. And I do hope that we could, even with all of these difficulties, that we can hang on to all of these beautiful changes that have already been taking place, and that we're starting to roll out really beautiful programming, just to see it all go back is going to be very heartbreaking. Thank you so much. There's a final slide. It's cute if you want to look at it. Oh no, another one. The last one. There you go. Thank you very much.
Ingrid, thank you so much for that presentation. I know we're running a little bit behind, but I still want to give people an opportunity to ask questions. And I also just want to uplift that, this work in particular, everything that's happening outside of the clinics is impacting what's happening in the clinics, what's happening in the classrooms. This work is very personal. And so when we think about taking care of providers, what's going on in the world, it really impacts people. And just thank you for bringing that into the room. Do people have any particular questions for Ingrid? Eli.
Yeah, thank you, Ingrid, for just providing such an emotionally moving, I guess, kind of vision of what the work that you're doing and encapsulating it in a way that really kind of resonates and hits me personally and on so many levels. So I just really appreciate that. But I was just curious. I mean, you work with a diverse kind of subgroups within the Latino community, right? I was just curious to know how you guys navigate and frame mental health and in that was very kind of specific subcultural context for them. So I know you might have some folks who are maybe come from indigenous tribes from Central America and then from Mexico, right? And so like, how do you navigate? Because they might all have different kind of conceptualization of like what mental health is. And I was just curious to know how you navigate that conversation or your providers.
Well, we have outreach and engagement dollars. So the groups and workshops that we have, they're for early people that maybe are not ready yet, but we usually get people that have attended Beyond Trauma, which is a 6-week, 2 hours a week psychoeducation group about what is trauma, how does it show up in our bodies? Oh my God, we're accidentally passing it on again. The cycle's continuing. And then people come out of there, we're like, oh, I think I need to go see a therapist. And they do, they come prepared and they're committed and they're engaged. And people are hungry. They want mental health services, but they want culturally specific mental health services. They want to be able to sit and feel, I'm kind of at home right now. And so that's how we get buy-in. But you're right. It's hard because there is still stigma, but I will say that the stigma is shifting a little bit. People do want mental health services.
I just want to say great presentation. We run a lot of Latino substance use disorder services, see the same kind of dynamics. Really, really appreciate what you brought to the committee here. Thank you very much.
Yeah, I'd also just like to add my 2 cents, Ingrid. I really appreciate your presentation and value the work that you all are doing. Thank you so much for doing what you do and then sharing it with us, because I know that's an extra load to carry, but really appreciate your time.
Thank you, Ingrid. So it appears we have a special guest. Who might have stepped on their intro. Governor, are you here?
I am.
So I'm happy to introduce Tina to me, also Oregon's governor, also whose council this is, it's time that y'all met. So, Governor Kosak.
Thank you, Amy, First Lady, Co-Chair, Chair. Hey, thanks everyone for letting me drop in. I know you've all been doing really great work, and whenever I can pop in and say hello and say thank you, I want to do that. So I appreciate you letting me take just a few minutes of your time today through your very well planned out meeting to say hello and to say thank you. There's just so much going on every single day. And whenever Oregonians are willing to step up and contribute their time, their expertise, and be vision centered and looking forward to the future about how we can make things work better in the state, I'm always so appreciative of that. And I also want to say congratulations. So thank you for serving on the council. And I hear that we're hitting some milestones with action plans coming out of the subcommittees, coming up to the full council. All of that hard work and information gathering you have been doing is starting to coalesce in action plans in very concrete ways we can make things better for Oregonians in the state. So congratulations on making those next steps. I also wanted to say that I also know that everybody who has volunteered to be part of this council shares the same vision, which is we want to make sure that when people need health care, mental health care, substance care, whatever it is, that they can find it wherever they are in the state. And what makes that work is making sure we have the workforce that is there, feels supported, feels appreciated, stays in the field, continues that continuity of care, particularly for our Medicaid population. And I have the great opportunity to obviously be married to Amy, who has taught me a lot about what it means to be a provider in the field, and what we need to do to make sure we have people there day in and day out in whatever type of treatment setting it is that can meet the needs of the folks who really do have to have this help and should have that help, because that is what we want to do in Oregon, to be a place where people can get the healing and recovery that they need. And they need well-supported professionals to do that. I understand today, part of today's agenda is presentations from Adelante Mujeres and Latino Network. I think I caught the tail end of the Adelante Mujeres presentation. I just want to say thank you to our culturally specific providers. Thank you specifically the individuals who are here today. This is hard work anyway. And we have a federal administration that's making it even harder for communities of color. And I just want to say thank you for sharing your wisdom and experience as we work on the recommendations, or you all work on the recommendations to come to some specific actions that we can take forward in the months and years ahead to support not only the entire workforce, but a diverse and culturally responsive, culturally specific workforce, because we have to have a workforce that matches who we are as Oregonians. So I just want to say thank you for that. My experience has been when we put smart people in a room and talk about problems, but not just the problems, but the solutions, and coming with action steps, we do have success. And I want you to know that when I came in 2 years ago, 3 years ago now, I guess, we had the Housing Production Advisory Council. Housing has been a big priority, just like behavioral health, and making sure that we had people coming together with an action plan and then taking those action steps forward. We've been successful in the legislature on the Housing Production Advisory Council's recommended plans. We're not done. First session, we worked on them. I think we got to a third of them. We're going to keep moving forward on that council's recommendations. Same with this town council. We need to have plans. We need to have specific actions. It's not enough to, develop the problem set. And I think you have been noticing probably in the last couple of weeks as you've been getting more information, there has been a tremendous amount of energy and focus on this idea of how do we support the behavioral health workforce. And there have been legislatively directed committees looking at different pieces of the solution. And what's great about this council and the timing of the work you're doing is you're bringing new eyes to certain parts of the talent assessment that came out. You're hearing what other groups have been doing. We got to put it all together. I want this council recommendations to be a one-stop shop of everything that's been happening in addition to the work that you're doing now, so we can stop in some ways analyzing the problem, but look at the solutions and the action steps. And you are so critical to doing that. I cannot wait to see what you come up with and where you land with your set of recommendations. And my pledge to you is we're going to take it all the way to the end. We're going to keep pushing hard. Some of this is going to be challenging because of resources, but some of this doesn't have to do with resources. This is about how do we do what we're doing better in the state based on the things that we can change so we can support the workforce we need as we build the physical capacity out there for more treatment beds and things like that. We need that workforce. We need those beds. And my job working with all of you is to make it happen. And I just so appreciate everything you're doing. And I know you're in good hands with your chair and your co-chairs and all the staff that's supporting you. So think big, be specific, Let's keep going. And I just want to say thank you for everything you're doing. This is a very important moment, I think, for this topic. And I know you're going to bring it home with some really great ideas. So thank you very much for the time. And thank you for letting me drop in. And now I'm off to another meeting. Thanks, everybody.
We have a lot on the agenda. We have a lot on the agenda today. And it's all important. So I appreciate people's grace as we're moving through and bouncing around. It I think it's really important for people to understand how important this work is and how valued your time is. And so I think probably, let's see, I want to make sure, I want to, Veronica, are you okay if we go, should we keep going? Or do we want to take a break, or can we keep going?
Whatever you prefer, First Lady. I can stay on if you want to take a break first.
Do people, we're, okay, you know how I do this thing where, we'll probably need to shorten our break. We may end up not being able to get to every plan today. We knew we had a packed agenda. We'll make that time up. And people have been really gracious this whole process. So do people want to take like a 5-minute break now? You know, grab a glass of water or something like that. And then we go back into it because we have about an hour left. Yes, so that's a thumbs up.
Yes.
Okay, so it is, I'm always tough at this. Let's do 3. Let's give you a couple extra. How about 3:05? A couple extra minutes. Okay, great. Great job. I appreciate people coming back. Also appreciate everybody's dedication and attendance for all of these meetings, and for when people have to miss, which of course they sometimes do. There's a lot going on. That's the advantage of them being recorded. And so every time I say this meeting is being recorded and live streamed, you know, when people have to miss, the ability to catch up is great. And well, my folks that they can watch this to give their feedback. So I'm going to keep rolling. Next, I want to turn it over to Veronica Leonard, Associate Deputy Director of Programs at Latino Network. Veronica is a leader in culturally specific, community-centered organizations with extensive experience in behavioral health, public health, cross-cultural program development. She represents community priorities at the state level through her role on OHA's partnership and the Reproductive Health Equity Fund Steering Committee. Originally from Mexico, Veronica has worked across diverse cultural contexts in Mexico, Guatemala, and the US. She holds a BA in psychology from the University of Oregon and a dual master's degree in social work and public health from UNC Chapel Hill. Veronica, thank you so much for being here with us today. I think you kind of got it. If you have slides, you just say next slide, and the fantastic Chad will step in and help and move it along.
Thank you, First Lady. And I'll be leading my own slides since I updated them since I sent them to Chad. So thank you. Thank you, First Lady, for the invitation to present to you all today. And good afternoon to all of the council members. I want to call out before I begin my presentation the mentors that Latino Network has received in order to do this work. You have Ingrid here, who has already presented to you, as well as Doctora Ruth Zúñiga from Raíces de Bienestar. We would not be where we're at without the work that they did before us, and they continue to support us in our journey to have a mental health clinic. Latino Network was created in 1996 to serve the growing Latina population and to ensure that the inequities that we were facing were understood and being addressed by policymakers. We now serve over 14,000 people a year through 60 different culturally specific and responsive programs spanning from early childhood education, middle and high school youth development, college and career readiness, economic justice, and health and wellness. Over the years, it became really clear to us that our community had very few places to receive culturally specific mental health services. Our school-based staff would often identify risk factors for mental health concerns and encourage their students to use the services at their school-based health centers, only to find that students would not go to their appointments, would sneak out after the staff person had dropped them off at the center, or just plain out say, I'm not going there. A really clear example that comes to my mind is after going to their first appointment, one youth spoke with their mentor and said, I can't go back to see this therapist. When they asked me, what my living situation was, and I said, I live with 11 other people in a 2-bedroom apartment, they just blanched. And I realized this person had no understanding of my lived experience. So we tried to build a list of culturally specific providers and responsive providers so that we could refer our participants to them, but there were never enough services. There was always a really extensive waiting list. So in 2019, we decided that we would build out our very own mental health clinic. And then the pandemic hit. And so we had to address the issues that were right before us, serving our community who was being disproportionately impacted by COVID. But experiencing COVID only doubled our resolve to create our own program because we saw that mental health needs were only exponentially increasing under the pressure of COVID. Our youth incident reports were reporting many more suicidal ideation situations than before. Parents were reporting increased stress and the lack of tools to cope with the isolation and stress of the pandemic. So in 2022, we began the process of learning how to launch a culturally specific mental health clinic. At the same time, we built out a non-clinical program. So what this was focusing on was working with staff to provide sessions that would help them understand what mental health challenges like depression, anxiety, trauma, substance use look like, reduce that stigma so that they could also have more tools to be able to work with their participants. We led community outreach and education events like the one you see on the screen, where our CHWs went out into community to help folks understand what mental health was. And we also began hosting bachelor level interns, BSW interns, to implement a social emotional learning curriculum so that these interns could gain critical early professional experience in working in the mental health field. And I'm really proud to say that this June, we obtained our certificate of approval from OHA for our very own culturally specific mental health clinic. We chose the name Zenit Centro de Serenidad, leading in Spanish with the name, to reflect the many barriers that our participants and also our professionals have to overcome when they're entering either mental health services or entering this profession, as well as the guiding star leading participants and interns and staff towards success. We intentionally did not include the words mental health or clinic in the name to not scare folks away who may be hesitant about receiving these types of services. For a nonprofit that had never billed Medicaid, it has been and it continues to be quite an endeavor. And Ingrid spoke to me about this a little. As we learn more and more about the behavioral health system and the complexity of providing services. While my presentation today is focusing on the challenges of workforce recruitment and retention, I'd be remiss to not add that in order to have more options for community, for BIPOC and culturally specific community to have access to mental health services, we must simplify the certificate of approval process. The vision of Zenit is a future with equitable, compassionate mental health for Latina individuals and families. And our mission is twofold. We're both expanding access to culturally specific mental health services and critically expanding the workforce. We see our clinic as a teaching clinic, a place where we are building tomorrow's culturally specific workforce. With care that is deeply grounded in cultural humility and responsiveness, Zenit offers a healing-centered approach that honors language, identity, and culture. We recognize the importance of family, spirituality, and community in the therapeutic process, and we strive to reduce barriers that have historically limited access to mental health care for our community. We do this by focusing on a culture of stress, identity, family dynamics, intergenerational conflict, grief and loss, and the stigma around mental health. And I must say that with the increase in federal immigration enforcement activities that have blown up in recent weeks, we are also seeing a steep rise in community needing support through deep traumatic events, family separation, and hypervigilance. We offer a continuum of services with our CHWs, QMHAs, providing that first touch with culturally specific tailored case management and outreach and education. They are guiding our participants through every step of the process, from that first call when we receive an internal referral from the other programs in our organization to throughout that process, right? So they're the ones that call, set up that first appointment with the therapist, but then are also providing that case management, reduction of barriers throughout the time that they're in Zenit. We offer individual, family, and group therapy through office, telehealth, and home visits, although home visits are not happening right now due to the increased danger for our community and our staff, given the racial profiling that we're seeing in immigration enforcement. This is our team. Our services are delivered by a diverse and dynamic team of bilingual Spanish, English, bicultural professionals. We have one licensed clinician, Lucrecia Suarez, 2 qualified mental health professionals under supervision, recent grads, CHW, qualified mental health associate, and 2 MSW interns who are providers in training. And we actually envisioned the first few years of this clinic only having a clinical supervisor and interns, just to kind of give us a slow start to the work. And when the current federal administration began, our board recognized the critical importance of moving faster in the trajectory of this clinic, and they provided us with some reserve funds to be able to hire 2 clinicians right away. So our team is bigger than we thought we would be for the first couple of years. As a training clinic, all of our providers receive continuous training and supervision in evidence-based, evidence-informed, trauma-informed, and culturally responsive care. This way, we're ensuring that each person is receiving services that are effective, that are relevant, and that are rooted in best practices. And while our staff come to us with lived experiences, their graduate programs usually do not cover how to incorporate their lived experiences and their understanding of our culture into these evidence-based practices. And Ingrid spoke a little bit about the additional ways in which our community finds healing. So there's that disconnect around how to bring in both of those elements. So our clinical supervisor will be focusing much of her training on how to join those 2 worlds. I'm proud to say that we're already starting to see an impact in how our BSW internships are feeding into this pipeline of workforce with the 2 Amy's. They were our prior BSW interns. And Alma and Saraid are current Latino Network employees in other departments who are in graduate school as well. And we were able to bring them on as interns. Challenges. So from the beginning, we knew we would need to focus on workforce development if we were to be successful, right? That's why we are where we are, because there were no services where we could refer our clients to. So we knew we had to build the workforce. One of the reasons why it took us 2 years to complete our certificate of approval process was difficulty in recruiting and retaining a qualified, culturally specific clinical supervisor with enough knowledge to help launch the program. Even having staff who could supervise our BSW interns has been a challenge at our organization. There's maybe 3 of us that have an MSW, and so it was hard, and we had to negotiate with universities around who could be their supervisor because so few of us had an MSW. So this, for me, really speaks to the dearth of Latinx in mental health field with the licensure and with enough years of experience and interest in supervision. And to Ingrid's point around how she would have loved to be in supervision, but she wasn't given the opportunity to do that because they wanted her to only be seeing clients. That is part of this reason why we don't have enough supervisors. And we have a limited budget, so we can't always compete with offering competitive salaries to the experienced clinical supervisors that we really seek out. We believe that another reason that there are not enough Latinas in this field is the stigma around mental health. And we've heard from our families, from our youth, and even one clinician around how some families don't see the mental health field as something that they want their kids to go into. One clinician told me, that her parents were really focused on her going either into medicine, engineering, or the law. And it never occurred to them to encourage their child to come into this field. There's also a deep burden on first-generation college students. So many of our students need additional support to navigate higher education and help with bringing their family along so that they understand what the challenges are of being a college student or a graduate student. Many of our interns over the years have also shared that they feel super lonely in their programs and don't see other folks like themselves in their programs, and that the roadblocks that maybe white college students would encounter to them, given all the additional barriers that they face, feel just completely insurmountable. Furthermore, many internship placements don't offer a cultural match for students. And so again, they're feeling that loneliness and that tokenization of being maybe the only Latina provider. And then they get overloaded with all of the clients who speak Spanish, and they quickly burn out and maybe even drop out of their schooling. And lastly, as Ingrid also mentioned, with all of the immigration enforcement activities, I expect our staff will need additional support and rest in order to process what they're hearing from their clients, but also what they're hearing from their families, what they're experiencing day to day when they go home after work, and the fear of what might happen in a mixed status family. So solutions. Some solutions to these unique challenges include offering non-traditional pathways for CHWs to obtain a QMHA certification. I really appreciate Casey's presentation earlier today, and sounds like you all are also recognizing this as a solution to help folks get into this career pathway. This allows them to enter the mental health field and get a better sense of what the career really entails before committing to higher ed. Internship opportunities for Latina students at culturally specific placements is also really critical. And we've worked a lot with area universities in order to be able to take on interns. And we hope to continue to be able to expand that, and that universities actively are seeking out culturally specific partners so that they can match their BIPOC students so that they can really feel seen and appreciated and can show up as their full selves within that internship. The culturally specific supervision is also really critical, right? So as a Latina young professional, if your supervisor does not have that cultural match, it's going to be really hard to talk to them about some of the things that you're seeing in sessions, some of the concerns, and have your supervisor be able to provide suggestions that are culturally grounded. And so again, we need to also build that supervision pipeline. We are also offering graduate students a $10,000 stipend in order to be able to complete their internship with us. We cover test fees, certification costs, as well as time for them to study for any of their certification exams. We're currently exploring loan repayment options as well as relocation costs if we're hiring from out of state. And fortunately, because this is within Latino Network, in order to address the less competitive wages, we are really lucky that we can extend a pretty amazing benefits package. So at Latino Network, our staff receive 12 days of paid holiday, 15 vacation days, of course, 12 sick days. We also get 15 days of self-care time on top of that, a paid sabbatical at every 5-year anniversary, and employer paid health, vision, and dental, and a 401k with a 2% match. So Latino Network during the pandemic recognized that they really needed to support staff in many different ways. And so we've really expanded that benefits package in order to help staff be able to continue this work and not burn out. And so I'm proud to say that we can, sometimes we can help folks say, well, we can't pay you quite as much, but look at all of this other stuff that we can give you. So those are the solutions that we've been seeing. Again, we're very early in our journey as a clinic, so we don't have as much experience as Ingrid or Dr. Ruth to share with you. I'm sure we will find many more challenges and hopefully solutions as we continue on our journey. Thank you very much.
Veronica, that was fantastic. Just the cross section of all of the things that we've been discussing for so long. I just really quick want to point out a couple of things I noticed. Thank you for doing the thread between schooling and licensure and the whole process and how that sets people up for the ability to supervise others. I think you walk through that very clearly and it is a hard thing to articulate and understand. And it was so helpful to bring all of those things together. And then I just also wanted to call out particularly thinking about it, compensation as a benefits package as well. In that we talk about wages and benefits rate are critical and sometimes the thing. And so sometimes that is the thing, particularly for a workforce that we all know has some, experiences vicarious trauma and has some medical issues, like the compensation package really matters. And I've heard that from providers in the field. So thank you for lifting that up. I know we're running over and that is okay. I still want to give an opportunity for questions here or comments because I think it's really valuable. I know Robin will agree with that. And so I just want to take a minute if people have questions or things they want to say. Rick, please.
Veronica, great presentation. Thank you very much. In my agency in Central Oregon, we have a lot of Latino providers, and one of the issues we've run into is people who have their graduate educations in very prestigious universities in Latin America, and those are not recognized by the licensing boards, and that really hampers their ability to get, they're unable to get licensure. And so I'm wondering whether that's a strategy that makes sense from your perspective and your agency. Thank you very much.
Yeah, thanks, Rick, for that question. Yes, our clinical supervisor actually studied psychology in Venezuela, her home country, where with a bachelor's you are a psychologist. And when she moved to the US, she had to go back to school and get her LCSW. So it is quite a commitment in order to get re-licensed. I would really appreciate this council looking into some kind of reciprocity or revalidation of studies abroad. I think we would be able to bring in some really amazing talent if we could do that.
Just giving a nod to the licensure committee, you all. Veronica, I just wanted to say thank you again for taking the time. I'm just curious and concerned. You all have had to get up and running really quickly in a really challenging time. And just wondering, what are some of the things that have helped you be successful? Because it sounds like you are able to step up in this moment. And just wondering if there's some key things that you've learned that would be helpful for us to know about.
I think I don't have many gray hairs, but the ones I do that are hiding under all of my plenty hair, they have all come from Zenith. I think having some kind of mentor type or like advisor type position at OHA for how to launch, how to apply for a certificate of approval, and how to go through all the hoops, like what electronic medical records to use. We started off with simple practice because we didn't want to go big. We don't have a lot of funding. Then we realized, oh wait, that's not compatible with roads. So now we're switching to Reliatrix. Like all these things, people know them already, right? So, and we even had the fortune of some seed funding to be able to hire a consultant to help us through some of these things. But for other organizations that don't have that, it's really impossible. So I think some kind of like user guide flow chart would be really helpful.
Wow, I love that. I don't know where that needs to land, but First Lady, maybe we can brainstorm about who needs to hear that. I think that's a brilliant idea. Thank you for sharing that.
Also, thank you for bringing up electronic medical records. It is because some of our people are served in places, their ability, if they need to go in the hospital, and if there's not a way to connect their records, their care is fractured. And so it's expensive. It's not a problem we're going to solve today, but it is important that electronic medical records and quality of holistic care are connected. And so just appreciate you bringing that into this space. Okay. Well, I think then we will move into, and the other thing I would say is appreciate, as we've talked about this being an iterative process, this allows us to add things and change things, and we're going to continue to have conversations. Staff have been working with different organizations, and then we'll be doing some more work with culturally specific organizations, and then bringing things back to the council. So we've pushed out some plans to get some further consultation. So just to let you know, and then with that, I'm going to close this, and I'm going to turn it over to Robin.
Thank you, First Lady, and just thank you for our guests. Please don't feel like you need to hang around for us to go through these action plans. And you're certainly welcome to share the joy of our action plans, remembering that these are all built off of the recommendations from the Talent Council. And our goal is really simple in this work, and we're all doing the same thing. We're trying to build a behavioral health workforce that's more accessible, easier to navigate, and more equitable. And so hopefully the plans that we've started to put together for you today are moving us towards that. So I've got 3 of them that I'm hoping to be able to get through today. I'm not going to read every slide. Hopefully you all have had a chance to at least peruse the action plans that were shared, but we will hit on each of it, and I'll stop at the end of each action plan to get some feedback. One thing the First Lady already mentioned, and I just want to reiterate, is that you will hear some similarities, some themes from just the 2 action plans we've already heard from today. I think that's going to continue to happen as we do this work, and I agree. I think it's a good thing. That means we're hitting on the things that are really important, and so I'm hoping that we'll actually pull those themes that we hear across action plans out and lift those up, because I think the things, if we're seeing them in multiple places, it means they're really important. So you can keep an ear out for that as we go today. Before we jump into the first slide, I just want to thank again our subcommittee. There are a couple people here from the subcommittee today, and if I miss anything, please feel free to jump in. And also a big thank you to our HEC support group, which we couldn't be doing any of this without them. So big gratitude before we start. Okay, Chad, I think we're ready to launch. Okay, so the first one we're doing is developing clear pathways. And this plan is to help address the behavioral health pipeline. So the students that get lost between high school and post-secondary programs, and then the workforce. How do we help align all of those things better? We want students to be able to move through the system without confusion, without losing credits, without needing to already understand how the system works to be able to succeed. And the heart of this plan is really alignment between curriculum, agencies, and institutions. And so you're going to see that in those focus areas that we are going to flesh out in the upcoming slides. So Chad, our next slide. There are 4 main strategies for developing the clear pathways. That's curriculum development, transfer and articulation agreements, career pathways, and ensuring equity and access. So the things to know is that curriculum development needs to align behavioral health competencies with employer needs, and we're really pushing for that. Transfer and articulation agreements have to work for the students so they don't lose time and they don't lose credits, and so that needs to be fleshed out and become a lot more clear. we need to have career pathway resources that show students exactly what courses and credentials are needed to be able to get them into a job. And then that equity and access piece needs to be in place so community colleges, universities, high schools can all participate regardless of the size and location. So this all needs to be very collaborative. We're asking that the HEC, ODE, OHA, and the Oregon Transfer Council all work on this and that we have a playbook so we're coming from the same place with all of these pieces. Next one, Chad. So our key outcomes and goals, again, there are 4 outcomes that we're trying to move towards around participation, alignment, access, and collaboration. I think the important things I want you to know is that the outcomes are centered on moving things forward so students can progress smoothly through programs, transfers become a bridge, not a barrier, educational timelines are shortened. We've already talked about how things take so long and we lose people in that process. And so how do we tighten that up? And then ultimately, how do we get more students to enter and stay in the behavioral health workforce? So that's really about creating a talent pipeline that actually functions from end to end and not sort of like these places where we plug in but don't actually feed the whole thing. So we're really trying to be careful of that. Anytime we improve pathways, we have to look at who benefits, but also who might still be left out. And so Chad, if you can forward. That's where the equity opportunities come in. We need to be thinking about inclusivity in curriculum design, how we're having culturally responsive tools be interwoven in everything, and a focus on our underserved communities so that we're making sure rural and low bandwidth communities don't fall through the cracks. We need to ensure that advising and resources and materials are culturally responsive so that everybody is getting what they need. And then making sure the system is easy to navigate for first-gen students and students who are balancing work, caregiving, financial barriers, right? The list goes on. And the First Lady and I both know, as folks who went back to school later and had to figure out how higher ed worked as a first-gen student, it is not easy. And so we need to be super mindful of that as we're thinking about the pipeline so that there's room for everybody in that. And I do want to say one thing I love about our action plans is that equity opportunities are embedded in every one of these. So we're going to keep coming back to this for every action plan because we want to keep an eyeball on it. So there, of course, there are barriers that we may find. And so Chad, if you can move us to the next slide. Some barriers that we might see with developing clear pathways are around funding and staffing. That's a big one, right? There's data integration. The standards are different at different institutions, which is really challenging. And so how do we start to level the playing field so people know what to expect? And then also thinking about digital equity and accessibility gaps, because those are tough when we're talking about education and how do we fill those in. So there's a timeline that I think is all of our timelines are very aggressive. Like, okay, if we can just plug into this, we can do this work in 3 to 9 months. Whether or not that's actually doable, that's what our proposal is that if we can make this happen, this doesn't have to be a long-term thing. We can actually make some change pretty quickly. So Chad, actually, if you can stop share for just a minute so that we can just pause and check in. So my 2 questions for you are, do you feel like the action plan meets that goal of developing clear pathways? And is it clear how or that this action plan will increase our workforce capacity? So thoughts around either one of those. Clarissa, I see you nodding, so I'm going to take that as yes, I think this is reasonable.
I think they look amazing. You guys have done great work, and it is all encompassing, which I love.
Yeah, it's big. It's big. Okay, so I'm not hearing any concerns or changes, suggestions that we need to make. So I'm going to go ahead and move us forward to our second plan. Again, just also be mindful of our time. So thank you, Chad. You're just on it. Our second action plan is around transparency and licensure requirements. One of the things I appreciate about this committee is that we all jump in on all the different areas. And so the same way that the earlier committee also shared some ideas for communication and education. We're jumping in around some stuff around licensure requirements, and I'm sure you'll hear more of this from the licensure subcommittee as well. But just to start us out with this, we've jumped in to help out, making sure that licensure information is straightforward, multilingual, and centralized so people aren't having to navigate in the dark. And these are the areas of focus, again, to just kind of launch into the big picture of it, is that we need to develop the multilingual, culturally responsive licensure toolkits, that behavioral health resource hub that was already mentioned, that shows up again here, establishing a cross-agency work group, because we can't just do this in silos, that's not working. And then one of the things actually that our guests shared is, how do we have mentorship and navigation programs for underrepresented groups? I think that was brilliant, and I hope that we can do more of that. So let's get more into the weeds with this if you want to move forward, Chad. So our key strategies include developing multilingual, culturally responsive licensure toolkits. Really, we just need to make things accessible, and that's the same thing with having a licensure information portal, because everything needs to be accessible. That's that hub that we were talking about. How can we make sure that we have cross-agency groups so that there is alignment and transparency? And then that final piece around mentorship and navigation pilots, so that we can support people, especially people from underrepresented backgrounds, to know that they have a place in this space. That's all of that is key. And this, if we are able to do these things, the next slide is where we hope we're going to go with these actions. So the outcomes are and goals probably make a lot of sense. If we can get it so that people can quickly understand which licenses exist, what steps they need to take, and how long the process will take, then that improves access for job seekers, and it also helps employers by shortening bottlenecks. So ultimately, this creates a smoother on-ramp into the field. If we can do those things, then these are the outcomes that we would hope to see. And then, as always, we need to think about equity. So Chad, if you'll take us to that slide. Thanks. So licensure barriers disproportionately affect rural communities, multilingual families, and people that don't already have professional networks. So by providing clear, accessible tools and navigation support, we're reducing sort of that insider information piece of like only the people that understand it can navigate it. This way we can broaden it and broaden who's able to enter the field by just attending to some of these equity opportunities. Now, it's easy to say, we just need inclusive design and multilingual access and trust building. That's great, but we all know that's not as easy as it sounds. So Chad, if you can move us to our next slide about barriers that get in the way with transparency about licensure requirements. Again, funding and staffing, we don't have people around to help answer those questions. We need data systems that actually align with the needs of the people that are trying to figure out the licensure requirements, because it's confusing. We need to have representation from marginalized groups in design and review processes so that we know that it's hitting the mark. And then we also need to, again, talk about access in the digital space. So, Chad, if you could just stop sharing so we can talk about transparency around licensure agreements. Again, same two questions. Are we meeting the goal for the action plan? And is it clear that how this will increase workforce capacity? Any thoughts about those two prompts? Yes, First Lady.
One of the things I just love about this and want to point out is often, because we have this, we have these committees a little bit separate, because this is a different point in time. People think about a license or a credential when they need one. This is before they even thinking about what this way earlier in the process, before they begin, like as a part, when you're going into college, when you're thinking about a credit, so I just want to make, and I think people know that, but I just want to be really clear that how important that is. And that was underscored in the Talent Council, because that allows people to make also choices about where they want to go. And so
Right.
it allow, we need different information for what you want to know as somebody who is, has post school or post CADC, what you want to know to get your credential is very different than when you're thinking about this. And so I just appreciate how this is a different stage of development, and that the committee has identified why that's important and how that works together with just pursuing or thinking about why you might pursue the education. And then I love how it harkens back to our very first presentation about starting. You get into this sometimes just doing social services.
Yeah.
And then how you can then open those doors to thinking about a different credential. And so just want to say appreciate how they all fit together.
Yeah, I appreciate that, First Lady. I don't know about for y'all, but I knew like what the work I wanted to do, but I didn't know what the right pathway was for that. And that took a lot of hunting for me to figure it out. And if we can make that connection more seamless for people, then that takes away that delay, right? Of like, what is the thing that I even need to do to be able to go help people in the way that I want? So that's something that we are being mindful of. You all are so good. I'm going to push us through this last action plan so we can check it off the list, and then I'm going to let you go. So the last one is around improving communication and transparency. And we all know that the behavioral health field suffers from fragmented messaging, that there are different definitions, different recruit materials, different levels of access to information. And so this plan is really about statewide consistency. So no matter where someone lives or who they talk to, they're getting clear, accurate information about behavioral health careers. And to do that, we're going to focus on these 4 areas, and we can just jump into the next slide, Chad, that talks about the key strategies. So we're focusing on statewide multilingual marketing campaign. That's a really big one. So we can, again, make sure everybody's in the pipeline, that we're all in it together. A career guidance toolkit for advisors and educators seems really, really important. So we get everybody on the same page. Making sure there's a clear, unified definition of behavioral health so that we're all talking about the same thing. And then finally, a public behavioral health resource hub, which we've mentioned now. This is our 3rd time. I think we should just start tracking how many times we say hub, because we need to be able to support licensure transparency in the work and, again, make things accessible to folks. So next slide, so that we can see what success looks like. If we get to do all those things, then this is what we should see. We should see students being able to understand behavioral health careers earlier. Ideally, we're seeing that in high schools, that we have advisors and educators finally that have consistent materials, and the public sees behavioral health as a stable, respected, valued, mission-driven field. We all know we have just an issue with how we're perceived a lot of times, and I think that's one of the things we also need to address is behavioral health is important and valued. And so let's start to name that. The thing I want to just come back to is that equity piece. And so that's the next slide. We're prioritizing rural communities, multilingual access, and culturally grounded outreach in this work. If we don't, we're not getting it to the people in Oregon that need it. And so we need to really be thinking about that with our outreach. And you're going to see some of the same things that have shown up in other places, because this is the way we get engagement, is by making sure that we're broadening how we're reaching out to people. And then the last thing is, let's be clear about implementation. And this is really where we have the considerations that we need to be mindful of. So Chad, you can do that last slide. And these are the barriers. Again, it's interesting, isn't it, that some of the same things keep coming up. Funding and staffing limitations. I know that surprises you all. Me too. We need to think about our data systems and how they're lining up. Digital access. This is really hard, folks, in rural areas and low-income communities. That's the major barrier. So we need to be more mindful of that. And then finally, thinking about the just the risk of underrepresentation in these, especially the early design phases, can have a huge impact down the road. And so how do we be mindful of that at the very beginning? So, okay, you can stop sharing, Chad. That one was an easy one. So I'm going to offer you my last 2 questions. Did we feel like the action plan is meeting the goal? And number 2, is it clear how it's going to increase workforce capacity? Come on, y'all. We get to bring it home. What you got for me? Clarissa.
shocking that I'll have the question. I really appreciate that the subcommittee is looking at the very big topics
Yeah.
and the bigger picture. And I was just reflecting, I was sitting with a patient yesterday who is interested in becoming an addictions recovery counselor, and he didn't have any idea where to start or how to enter that. This is somebody who speaks English as their, first language. I was thinking when we were listening to the wonderful presentations about the cultural limitations on that, it's going to be even harder. Has the subcommittee at all discussed, like, with a hub? Do I get a point for the hub?
Yes.
With a hub, is there any way to like focus that in on what are the resources in your area? So like I'm sitting with this patient, I'm having this conversation. What are the resources I can direct him to that are
Mm,
here in my community in Southern Oregon? So I'm just wondering, I know that's like focusing in too much compared to the action plan, which is
mhm,
great big picture, but I'm
mhm.
just wondering if there's been any conversation about that.
Not so much. And Monica, please jump in if you have other memories of this. I think we were talking about people need to have access, not so much like what that was going to look like, how detailed it was going to get, where it was going to live. But I do love that Casey earlier mentioned that Massachusetts actually has a model that we can look at. And so that would so be actually where I would start is like, okay, what does that look like? What's missing? What do we need to include? And hopefully that would be part of the conversation. Ah, Casey, your hand is up. See, you were just going to say all this, weren't you?
Actually, so I'm so happy you mentioned that. One of the things that we mentioned in our action plan, there are a few of these sort of like more focused hubs that already exist. So, for instance, the Asian Health and Service Center has one that's specific to Asian providers who want to go into the field. There's also one that's specific to the Columbia Gorge and like sort of opportunities there. So I think for some of those that already exist, we can sort of, plug them into, and then for those that don't, we potentially have a model to be able to say, we can have this larger hub, and then within that, we can have like, are you in Southern Oregon or Central Oregon or looking to go into culturally specific services? Here's, the specific resources that exist for that. So I think that's a really great flag.
Yeah, and one of the things I love about that, Casey, is that we can all the links that we can embed in there. So let's say I am in Southern Oregon and I know I want to do this track and it links to Rogue Community College or it links to Southern Oregon University. And so it's not only how do I figure out what it is, then I get to directly go to the place where I can go do it. Like how amazing is that? I love that. Ebony.
Hey, everyone. I want to I assume, but figured I'd just still say it that I know, I just want to confirm that when we're talking about culturally specific or culturally focused or responsive, there's plans specific for the Black African American community as well.
Oh gosh, 100%. I mean, I think that that is such a huge piece of when we identify the communities that are being left out of these conversations, that we stop, that we stop and we have that acknowledgement of like, who are we talking about? And that we very clearly define that, because it's so easy just to be like, oh, we know we're missing voices, and then not to pause and say, okay, no, who are we talking about? And name that. So Ebony, thank you for just lifting that up, because that needs to be part of the conversation for every single action plan, 100%. First Lady, you don't have to raise your hand, just jump in. Wait, you're muted.
See, this is why I have to raise my hand. So Rod and Monica, our original talent council report. I just want to say, I remember the piece about guidance counselors and the importance of when we talk to we had students that were far along in their education, and when they talked to an advisor or a guidance counselor, they changed their major and then they stayed in it. And so we saw overall that really makes a significant difference in how if people going into the profession and how long they stay. So I just wanted to say thank you that I saw that. And we knew that was that it wasn't lost, because that was such an interesting statistic, and really was impressed upon me. So thank you for addressing that directly.
Yeah, thanks for naming it. And thank you, everybody, for spending your time listening to all the action plans. It was fun going through it with you.
Wow. This has been a meeting. Okay. Mostly I just want to be clear that still, you know, there may be things rolling around in your head in a couple days. You'll think, oh, but what about this? You can send feedback to staff. You can if you follow up on the phone, talk to people in your subcommittee. That's the advantage of this being an iterative process. If there are major discussions, we'll talk about that. And then maybe it's something needs to go back to the subcommittee. But we have I just want to put it out there that we had a lot to cover today, and all of it was important. And so that made it a little bit more compressed, but just know it's okay for you to have ideas that come out, and you want to make sure that they get back to someone and get reflected. That is totally fine. And you don't have to think of everything today. Our next meeting it's going to be December, December 4th, from 2 to 4. And I just also want to, I don't feel like, I also want to just thank the amazing staff that have just kept us, I mean, they have kept us, the ability to do this is about people being focused and moving through and thinking down the line and knowing when plans have to be done. And the first time I've been able to go visit some of the subcommittees, and they're just incredible, from the governor's staff to the agency staff to everybody who's working to make these recommendations come into something that can be utilized. I want to say thank you. I want you to know how appreciated you are. And congratulations on getting the first ones out the gate. So with a couple of minutes to spare, seems like we're going to see people in December. All right. Happy holidays.